Rheumatic heart disease, known as RHD, starts in childhood. And it was once widespread amongst all Australian kids. But today, it's almost exclusively found amongst young First Nations people. No child is born with this disease.
It's not just a disease of poverty, but it's a disease of Australia's failure to look after First Nations Australian people properly.
Rheumatic heart disease is a disease of the immune system in response to streptococcal infections, and it damages heart valves.
We came to have a look at our heart to see if it's doing good.
So when you have heart valve damage in children, it causes leak of blood back from one chamber of the heart into another chamber. It makes the heart work harder. It predisposes to stroke and infection in the heart, and that's what causes early death.
There needs to be more education on what RHD is and what families and communities can do to help prevent this disease. So if these kids don't continue having their monthly bicillin and they go months without it, some kids end up having open heart surgery to replace the heart valve.
It's no doubt that we need Indigenous leadership in this space. We need people to be confident and trusting in their health services, and from my experience that is much easier to do from Indigenous-led health services. They need to be culturally safe and appropriate and approachable, and I just don't think we can do that without strong partnerships with Indigenous health organisations. Rheumatic disease is the single most important thing to close the gap for cardiovascular outcomes in First Nations people. If you are an Aboriginal or a Torres Strait Islander, you're more than 100 times more likely to get rheumatic fever than other Australians. It really is a disgrace for our health system that we accept this as normal in our First Nations people. And it's a terrible shame. This is an entirely preventable disease. It should have been wiped out a long time ago. If we do nothing extra over the next 10 years, more than 1,000 First Nations people will die from rheumatic heart disease, and that will cost the health system hundreds of millions of dollars. If we invest that now in prevention programs, we can eradicate rheumatic heart disease in the future.
I've been getting injection every 21 days. I've been diagnosed with rheumatic heart since I was 14 years of age. It all started when I had symptoms like tonsillitis and joints pain and rashes. So then I went over to Birmingham for a wedding. Then I couldn't, it was to the point that I couldn't eat, like feed myself or even have bath. So then I was sick, just in bed for 3 days, and then my sister took me to Birmingham hospital for a checkup, and then they found out I had rheumatic heart disease.
So I treat kids from 12 to year 12, whatever age that is, I think 18. My biggest obstacle with these kids is building the first relationship with them, which is I have to make sure I get these kids trust. They like me, so they're going to be willing for me to give them this horrible injection. But now all the kids that I look after with RHD, I have made a wonderful relationship with every single one of them, and they don't fight me anymore, which is amazing. A lot of bribing has happened, but yeah.
Bribery or inducements are absolutely fine in these circumstances.
Yeah, so Tim Tams help. I'm very passionate about rheumatic heart because I feel I've worked so hard in the last 3 years at Nuckmin to build this relationship with each kid, and to have them willingly to come into the clinic and say, Jairani, I need my bicillin, without me having to hunt them.
Amazing. Yeah. And what differences have you seen in those kids? They must love you.
Some of them love me, some of them don't. I think now that I feel being sort of close in age with them, I feel like I've got a lot of respect in that because they think I'm their big sister. So I say, okay, this is it. You've got to have your bicillin or you'll be on the table. Kind of speaking the truth enough so they understand that this is serious. Some kids I take over an hour to give a bicillin. Some kids it'll take me a week, but we'll get there. But yeah, it's definitely tough when you've tried everything you can do, and then some kids will go back home for sorry business or something, and they don't get their needle because they won't go to the health service back home. And trying to call those communities to say, hey, can you go pop into a home visit and give them their bicillin? It's just not happening. I wish I can hop on a plane to every community and give these bicillins, so then I kind of know that these kids are looked after.
And this is the reality of us not having a voice. We've got these organisations that have the little buckets of funding to deliver, but the people on the ground are missing out. This is why we have to give this disease a voice. And by listening to you and what you are doing with the kids at Darragh College, we're saving 20 there. And you as a living example, and our brain over here, providing evidence-based research to say, it's true, facts are there.
I would give every family a house that they all have a bedroom by themselves. They all have a shower, washing machine. They didn't have to worry about walking down to a community washing machine. They have access to drinking water.
There's a whole host of adults out there with rheumatic disease, people like Pia. You would not know that anything is wrong with Pia. She lives well day to day with no symptoms, but she has rheumatic heart disease and has that burden forever.
It's very important as a registered nurse to advocate for your patients, clients, and for me I feel it's very important in my role as these kids, English is fourth, fifth language, and to kind of get them to understand why they're at the clinic, why they're so sick. Once they understand it, then they kind of go back home and say, oh, this is what I need to do.
I was involved in the coronial inquest into deaths of young women in Doomadgee recently. And clearly lots of those preventable factors were examined in that inquiry, and it's terrible that we're still having those inquiries carried out for our young people. It's absolutely clear that they're preventable and avoidable, and that, as I said before, we've got a real solid blueprint for how to stop these happening. We just need to implement it.
You can never put a price on life. You can't. It's impossible. These children, they're the future for all Australians in this room. Why isn't there a politician in this room right now?
If I had 200 more Jairanis around the country, she's too modest to say this, the children love her. Her outcomes are incredible. The kids at Jarragon get 100% of their injections. They call the health centres when the kids go back on holidays and make an appointment for the next injection. So, well done, Jairani and Nakmin. It's an amazing job.
In the context of our representative politicians, it's clearly not working. Their voices are not representing us. And this is why there is a need, because we, Pangaltur people, black people, have come together and we've gone, hey, we are trying to provide a solution to end this disparity. We are trying to reach out and say, walk with us, come with us, and help us solve our preventable disease.
I've got relatives who have RHD and I worry for them. I worry for the day I'm going to hear that a fatal event has come upon them. We just got to take a new determination to confront this problem. And Dr. Ben and all of you who've been working in this very stony field, be assured that there is an Indigenous leadership that wants to support you in this work and wants to work in partnership with you on this work, because we really want to tackle this problem.
Everyone that came into the event today, there was some hearts on the chairs. If you have a heart on your chair, can I please ask you to stand? You represent the heart of a young person that's died so far this year of rheumatic heart disease. We can do better. As a nation, we can do better for our young people. They're our hope for the future. They're going to ensure that we have more nurses, more doctors, more cardiologists like Dr. Ben, north of that line from Perth to Brisbane.